Namaskar. Good evening. Happy New Year to each one of you. And India has become a diabetes capital. Today I am lucky to have a Dr. T Raj Dev Patru, a diabetologist and a cardiologist who has been extremely done the research and doing good work on the diabetes. So, good evening, doctor. Happy New Year to you.
Thank you.
And you have been so sweet to the many patients.
Thank you.
Now I want to speak to you about the sweetness.
Thank you.
Most of the ads I see that reversal of diabetes, reversal of diabetes. Is it really true?
It's a very tricky question. When we talk about reversal, we need to understand that diabetes is a metabolic disorder. Reversal is possible when we make people aware where to go and stop their bad habits and streamline their habits to healthy habits. Then, yes, it is possible to reverse the diabetes. But if the diabetes is progressed very much and you have gained a lot of weight, if there is a hormonal imbalances and your ecosystem got deranged, then it takes some time and reversal is possible, but it takes longer time.
Diabetes type 1, type 2 diabetes is there.
Yeah.
In this, which one is easily reversible?
See, when we, as for the information and scientific reasonings are concerned, type 1 is not reversible. It is reversible only when beta cell starts functioning. So in type 1, beta cell disorder is there because beta cell either fails to release insulin or antibody which got generated in the body destroys the beta cell. So the main source of insulin is lost in type 1. So the reversibility is a questionable mark. Maybe with scientific interventions, genetic interventions, when we can able to regenerate beta cells in them, then it is possible. But type 2 is something which is not something where the insulin is not being produced. Type 2, the insulin production is there, but it fails to act. And there are other many reasons, weight gain and other reasons of insulin resistance leads to type 2. So the chances of reversibility is higher and possible in type 2.
Doctor, when the parents are diabetic, there is a fear phobia is there. Their children will get the diabetes. Are such children what they can do avoid this diabetes? So that prevention is better than cure. I think you are the right doctor who can enlighten us.
Yes, the question is very right at this moment. When we were studying in MBBS and when we were doing our post-graduation at that time, it has been said that genetically diabetes goes into generation. But now we all know it is not something which is just a single factor which causes diabetes. There are many factors which causes diabetes. If parents are diabetic, both parents are diabetic, the chances, the risk of getting diabetes is higher. But it doesn't mean that they will get diabetes, but the risk of getting diabetes is higher. And this is the catch point. When we are talking about children, kids, the new grown adolescent to adults, they are getting into goal-oriented jobs where they go into a lot of stress and they end up with smoking and alcohol and sedentary lifestyle. Definitely that leads to diabetes.
So in the such children can be mentored, doctor, easily to avoid the
Yes,
diabetes?
they are the target where they have to be counseled.
Okay.
And I would say it should be starting from the grassroots itself, from the corporate offices to schools and colleges, campuses. And wherever is possible, we need to make them aware for lifestyle modification to lead a healthy life, mindful eating, and sleep hygiene, mental hygiene is very, very important at this moment.
If diabetes comes, is it a life-threatening disease or it can be managed, doctor?
Diabetes per se, if you keep them under control, your lifespan will increase because of discipline. And once you lose discipline, then this diabetes will become killing, a silent killer for you. Yes, the most common cause of heart attacks, coronary artery disease is one of the thing in diabetes. Then follows other autoimmune disorders can also be associated with diabetes. And yes, neuropathy is one more, nephropathy is another thing. So these are the things, and repeated wound infection, chest infections, they are all complications which do follow if diabetes is not taken under control.
That one last question. A lot of diabetic therapists have been advising to the patient whom they come to us. They say that food is the medicine, you only diet, don't take the medicines. And there are some patients whom I am worried, they left the medicine, they are only focused on the diet. So please enlighten the audience because this is a very serious issue. When the patients are already on the medication and one therapist, diet therapist, telling that you have to take the only food and these are the diet, and when they stop medicine, how dangerous it is to the life of such patients.
Very sensitive questions, Dr. Raghunandan, you have asked this. This is a hot topic in the market now.
Yes.
When we open up our social media, most of the social media ads do come. We make you pill free, we'll make you medicine free from diabetes. This is not 100% true. You know, the course, the kind of schedule they make to inculcate in you is they become more aggressive. They make you exercise, and they cut all your carb content, and they say they become more stricter towards you to bring down the HbA1c and blood sugar levels so that you leave your pill. But you know how long it will sustain. When we talk about the term reversibility, scientifically your blood sugar should be under control and your HbA1c should be 5.5 for more than 1 year without medication. Then only we say yes, reversible has been achieved. But that 1 year of tough journey takes toll. So we need to see it doesn't fit to everybody who is into busy life, corporate life.
You are right, doctor. Moreover, cheap and based medicine, cheap and based medical centers and therapists, the people have been hunting. I think they are paying and taking the risk for their life. And I think your information is very useful to all of us. And doctor, you sitting in the Gurgaon, and I am sure that you was one of the diabetologists who started the Center for Diabetes and Allied Sciences. I think you have done the maximum research in the diabetes more than a services. I wish that, suppose if somebody out of Gurgaon or out of Delhi, somebody wants to meet you, what is the way out to reach you, doctor?
The best way is Dr. Saab's number, and we can give you the links to reach us. And
doctor, you can tell your number, your center number, so that let the patient lead.
Yes, the number is 9582500029. 9582500029. You can take appointments from them, and the landline is 0124-423-2805. Another one is 4232-196.
Thank you, doctor. On the New Year Day, these are the information and inspiring things should go to the people. You see, food is the medicine, but most of the patients, especially the parents and the senior citizens, the kith and kin, you must take a proper scientific, evidence-based advice from the right diabetologist. We can reverse the diabetes, but not all the time. There are certain golden periods there which you need to understand the doctor. And today I am signing off from Dr. Patru's clinic. I'll come with another doctor with another good topic. Thank you. Happy New Year and healthy New Year also. Thank you.